Hi, everyone. I'm Dr. Michael Richman, a double board certified cardiothoracic surgeon. So I recently wrote an article on my Substack page about the art of deception and how fringe practitioners self-publish false or misleading articles. And I've been asked by many of you to put it in an audio form because obviously people don't like to read anymore. The article's too long, so I'm going to try and summarize some of it here. So we live in an age where information flows freely and swiftly, and these voices of fringe, whatever you want to call it, medicine, come from those who reject established scientific consensus, and it's gaining traction, and that's really worrisome. And these self-proclaimed experts often operate outside the boundaries of academic rigor, publishing studies and articles that lack any credible evidence or scientific merit. And the proliferation of self-published content produced by these fringe practitioners really poses a threat to public health, but also to the integrity of medical discourse, if you will. These fringe doctors operate in a vacuum where peer review, which is the crucial component of the scientific method, holds little to no weight. And with the rise of online platforms, it's enabled these, whatever you want to call them, individuals to bypass traditional academic channels completely. And social media, personal blogs, self-publishing websites allow them to disseminate their research directly to the public without any oversight or lack of research. So one of the most prevalent methods these fringe doctors employ is the use of anecdotal evidence. And I always say anecdotes are not evidence. They share personal testimonials or success stories from a small subset of patients, and they present these narratives of conclusive proof of their theories or lack of. And then this anecdotal approach lacks any statistical significance and scientific rigor. And in fact, a lot of it's made up, but it resonates powerfully with individuals seeking hope or alternative treatments or who are angry just with the healthcare system. And many of these fringe doctors, utilize familiar academic language and style to lend an air of credibility to their work, like root cause or mitochondria, despite lacking the foundational knowledge to support their claims. And they reference genuine studies and use scientific jargon, like I said, creating a facade of legitimacy, and it misleads many of you, including many doctors. And the complex nature of scientific research allows them to cherry pick data that supports their position, and they ignore conflicting evidence, which is known as confirmation bias. So in this way, they manipulate facts to fit their false narratives, making their articles, or whatever you want to call them, their studies, seem more credible and convincing to an untrained audience. So what's the conclusion? In conclusion, the worrisome trend of these fringe doctors self-publishing studies that lack any academic rigor or truth raises crucial questions about the future of healthcare communication in our society. And it's only made worse by people like RFK Jr. and Dr. Oz. And as the lines between credible science and pseudoscience blur, it's imperative for all of you to remain vigilant and deep dive and figure out what's right and what's wrong. And while the right to share information is fundamental, it's essential to discern between credible sources and misleading narratives rooted in personal experience rather than scientific truth. Because the preservation of health in general depends on fostering a culture of critical thinking, scientific literacy, and a commitment to evidence-based medicine. And without these safeguards, we're really falling prey to the enticing allure of unverified claims, which jeopardizes the health and well-being of countless individuals. And I can't stress this enough. Just because something's on social media, the internet, doesn't mean it's true. And you can see there's so many stories of people who leave out details, or they publish studies, and there's so many fake COVID studies, for example, that were never even done, and yet the public believes it. So with that, hope you learned something today. Thank you so much for listening. For more information, guidance, advocacy, or a consultation, you can go to my website at www.paladinmds.com, and have a great day.